Cystitis is an inflammation of the bladder, commonly caused by a urinary tract infection, or UTI. This condition primarily affects women, but men and children can also experience cystitis. The symptoms of cystitis can be uncomfortable and disruptive, including frequent urination, a strong, persistent urge to urinate, burning sensations during urination, cloudy or strong-smelling urine, and lower abdominal pain. In some cases, blood may be present in the urine, a condition known as hematuria. The most common cause of cystitis is bacterial infection, often originating from the gastrointestinal tract. Most urinary tract infections are caused by a bacterium called Escherichia coli, or E. coli. Other bacteria can include Klebsiella and Proteus species, as well as, in some cases, sexually transmitted infections like chlamydia and gonorrhea. Cystitis can also develop as a result of irritants, such as certain soaps, hygiene sprays, or spermicides. Some individuals may experience interstitial cystitis, a chronic form of cystitis that causes long-term bladder pain without an identifiable infection. Risk factors for developing cystitis include being female, as women have shorter urethras that make it easier for bacteria to reach the bladder. Sexual activity can also play a role, as can the use of certain contraceptives like diaphragms. Menopause can increase the risk due to decreased estrogen levels, which can affect the urinary tract. Additionally, individuals with diabetes or those who use catheterization for urinary drainage are at a higher risk. Diagnosis typically involves a medical history review and a urinalysis to check for signs of infection, such as the presence of bacteria, white blood cells, or blood. In some cases, a urine culture may be performed to identify the specific bacteria responsible, guiding effective treatment. Doctors may also perform imaging tests if recurrent urinary tract infections occur, to rule out any abnormalities with the urinary tract. The treatment of cystitis largely depends on the underlying cause. For bacterial cystitis, antibiotics are the most common treatment, with the choice of antibiotic based on the specific bacteria identified. It's essential to complete the entire course of antibiotics prescribed to prevent recurrence and the development of antibiotic-resistant bacteria. Alongside antibiotics, doctors may recommend pain relief medications or over-the-counter remedies, such as phenazopyridine, which can help alleviate burning sensations and discomfort while urinating. Home care involves increasing fluid intake to help flush out bacteria, taking cranberry supplements, which may prevent bacteria from adhering to the bladder wall, and using heat pad therapy on the abdomen for pain relief. Good hygiene practices can contribute to prevention, such as wiping from front to back after using the toilet, urinating shortly after intercourse, and avoiding irritants like douches or bubble baths. Prevention of cystitis includes drinking plenty of fluids, particularly water, to dilute the urine and facilitate urination, which helps to flush out bacteria. Regular urination, rather than holding it in for long periods, is also crucial. Wearing breathable underwear and avoiding tight-fitting clothing can reduce the risk of irritation and promote urinary health. If you have recurrent cystitis, it may be worthwhile discussing preventative antibiotics with your healthcare provider. In conclusion, cystitis is a common condition primarily caused by bacterial infections. Recognizing the symptoms early and seeking appropriate treatment can significantly improve quality of life. Practicing good hygiene, staying hydrated, and following preventative measures can reduce the risk of recurrence. If you experience symptoms of cystitis or have recurrent infections, consulting a healthcare provider is essential for effective management. Thank you for watching and learning about cystitis today. If you found this video informative, please like, share, and subscribe for more health-related content.